What's up, friends? Welcome. It's time to elevate and thrive. And today, we're going to kick things off with an interesting story that you heard recently.
Yes. So most of you know Dr. Mark Hyman. He's a functional medicine doctor, MD, who practices holistic integrative medicine. And he was sharing a story that of ozone therapy and how it basically, he says it's saved his life.
Bold words, big words,
Big
Mark
words.
Hyman.
Yeah, that's huge, right?
Big words.
This is a man, too, who he's done a lot.
He's
right?
done all the stuff.
You've seen all his books. You know, he talks about food therapy, of course, nutrition, like IV, vitamins, doing supplements, so many things. And he had a situation where he got an infection, and it turned into colitis, which is inflammation of the lining of the colon, of your gut, basically. And they gave him antibiotics. It didn't quite treat it, so they gave him more antibiotics. He said he was just on round after round after antibiotics, and so it completely destroyed his gut.
Completely wiped his system out.
His system, like all the good bacteria, like basically
Gone.
So then he started, the symptoms of that were chronic vomiting, and unfortunately lots of diarrhea. And he's like, here I have all these tools at my disposal, and I'm failing. My body is failing. He's like, this is bad. And then if you do a lot of antibiotics, sometimes you can get an infection called C. diff. And C. diff is a nasty bacteria that comes from doing antibiotics. And it's very toxic. And so, and it kills people. So he was like, okay, this is bad.
Went from bad
Yeah.
to more bad to very, very bad.
Very, very bad. So a colleague of his who does ozone therapy said, you know what, like, everything else you're doing is not working. Let's do this therapy. And he said, one treatment, and this is IV, it's called IV MAH, or major autohemotherapy. One treatment, he said he was 90% better. It was, insane, right? So, and then he said he went on and basically everything calmed down.
He did a series of treatments.
And then he did a series of treatments after that. Yeah. But with the one therapy. I have another fun story too that I'd love to share about ozone.
Tell another crazy story about ozone.
This is another crazy story that I love. So,
and let me say, when I say crazy, I mean crazy in the sense that it gets us to think outside the bounds of what we consider to be normal. And in medicine, just like in life, we oftentimes have preconceived notions of what's possible and the way to do things. And especially when it comes to treating various conditions, a lot of times, many people are just not aware of the variety of different treatment options that exist. And it's just like a great metaphor for life. There's many, many different ways, many different tools. And if you don't know about them, they can't benefit you. But when you know about them, then you can consider this might be something that could help your situation. So that's what I'm saying. When I'm saying crazy, I'm not saying like woo-woo crazy. I'm saying crazy cool, mind-blowing, outside of the norm, different than what we're used to.
Yeah. Thank you for clarifying that, because I also was not taking that as like, oh, wow, this is an insane therapy. Like, you would never do this. It's crazy.
You have to be very extreme.
Yeah, right.
Hardcore. And if you are a wild, crazy, extreme, hardcore biohacker, then this is the technique for you.
Right. No, you do not have to be that person.
No, this is for anyone. I'm just saying it's an unusual therapy. It's not one that a lot of people have heard of.
Right. Yeah. So maybe I should take a moment and just quickly clarify. So ozone therapy is just basically using a form of oxygen. So it's O3. So what we breathe in the air is O2. And so O3 is you have a machine that turns it into that. And I'll get into this particular form of oxygen is a rock star at going into the body and creating a very aggressive healing change, right? Because it does that in a lot of different ways, which I'll talk about. So the second crazy story, right? So I go to a training, and a colleague is talking about they had just treated a young man who had he had sliced his foot And because he's in his early 20s, he ignored it. Right. So just let it go. Right. So
try to raise them right.
yeah, right.
They get to their 20s,
Right.
they cut their foot, and they just let it fester.
That's right. So it became gangrenous essentially before he went in, and
Also can be life-threatening.
that's pretty much, you're losing something at that point, most likely. And so that's basically what happened to him. So he went in, he was on multiple antibiotics, and it was the infection was basically just crawling. It was flesh-eating bacteria, and it was crawling up, up his foot, into his ankle. And so, after a few weeks of trying to manage the infection in the hospital, they were like, we have to amputate. So for a young 20-something-year-old man, for anybody, that's devastating. But you're in your early 20s, that's like, they were like, we're going to have to go below the knee. So, and take your leg off. So his parents were like, we have to find options. So found a functional medicine clinic that did ozone therapy. And so what happened. So this is the colleague I was talking to as part of that clinic. And she showed me the pictures. So I saw this foot, basically, that was, it was...
So this is secondhand, but
yeah.
firsthand.
It's secondhand, right?
Firsthand,
with Mark
secondhand.
Hyman, yeah.
Yeah, no, with the Mark Hyman, but that you heard him tell that story.
Oh, sure.
This story with the amputation or the gangrene. This was a person you actually know who was in the clinic, who is part of the treatment, part of the clinic, part of the treatment team.
Yeah.
You saw the pictures.
I saw all of the pictures, so I saw all of the progression from the beginning, of looking and seeing like this very extremely bloated, rotted foot, basically. And so what they did is they did two things. They did IV every day. So this is an extreme situation. So they did IV ozone every single day. I think it was like Monday through Saturday, something like that. He took Sundays off. And then they also did something called limb bagging. And so they put his foot into a bag of ozone and had it pump through. And they did that 30 minutes, I think it was like 30 minutes twice a day. So she showed it to me within the first week. It was still swollen, but there was like pink new tissue, right? The infection was regressing. By the second week, it was starting to look like a normal foot, right? And so the wound was healing, it didn't look gangrenous at that point. And I think it was by the fourth week, like it pretty much looked like a normal foot. Like he just, so it was more aggressive therapy, right? But he got to keep his foot, which is incredible.
Amazing.
Yeah.
It's a pretty crazy story.
Yeah.
Crazy awesome.
Crazy awesome. Yeah.
Yeah. It makes you go, well, what are the other uses for ozone? So if it could do that for an extreme situation, we had two extreme stories with Mark Hyman and with our friend who had gangrene. But you might be wondering, well, what about me and my health as it is today? I don't have an extreme situation going on, but I do have some things happening. And in that case, there are actually many, many ways that ozone can be part of that treatment plan for you.
Yes.
So why don't we talk about some of the different ways that we like to use ozone here that are a little bit more linked to stuff people might be experiencing in their day-to-day.
And not gangrene. And
not gangrene.
Yeah, foot amputation.
Extreme.
C. diff.
Yeah.
So top uses. So top uses, things that I've seen through the years, I find it to be really beneficial. And I want to talk about a couple that I feel have been a more recent in the last year that I've been using it a little more and getting great results. So top uses are things I think help people immensely. So one is going to be pain. So like acute and chronic pain. And that relates back to injury, or that could be like strains, bulging discs, any sort of joint disorders, tendonitis, plantar fasciitis, any of those, right? So again, acute and chronic. And it can handle, I've seen changes in people who have severe pain, related to these things and have done all of the other things, right? So, autoimmunity. So whenever we look at autoimmunity, what I'm seeing in people is that usually there's some underlying toxicity normally with autoimmunity. There's something that caused the body to flip. We think that it's viral. We think that there is, the body does a switch, you get a viral infection and the body makes a mistake, right? But not everybody who has viral infections gets autoimmunity, right? So what is that? Usually there's some underlying, the theory is that there's underlying toxicity. And so that might be heavy metals, that might be mold, that might be chemicals. But really, why did that person, we all have that exposure, why did that person get that thing, right? And many times it's, there's difficulty with the detoxing part, right? It comes back to, that person's body just doesn't do it quite as well. So we want to assist that. And I found that ozone is incredible because of that oxygenation of the cells. And I'll go into the benefits here in a second. The body you are actually assisting the body in being able to do what it is built to do, which is to, bind those things up and get them out.
When you think about the promise of regenerative medicine, a lot of times you could boil it down to, helping the body do the things it's already doing or supposed to be doing more efficiently, more effectively, more completely. And so that you experience then a benefit from that enhanced ability that your body maybe already has, but now it's magnified through this particular treatment therapy. So I love that. I love that concept. If you think, hey, this is going to help what your body's supposed to be doing, but help do it even better, supercharge it, optimize it, really give you a noticeable benefit, and kick your body over if it's struggling with something like a detox pathway or a detox dysfunction.
Yeah. And we have a lot of therapies that work with detoxification. I mean, there are a lot of things that we can do. And so I love using ozone as an adjunct to that, right? We're super oxygenating the cells to be able to do what they need to do. And I love like adding the glutathione, or we're using those bees to assist in all of that. So comboing is fantastic. So other things are actually then getting into just toxicity. Maybe you don't have autoimmunity, but you've got some sort of toxicity.
Perhaps like a mold toxicity.
Exactly. Yeah. So in the last year, I've started incorporating, we have a lot of detox protocols for mold because it can be complicated, and, it's pretty involved in detoxing your house, and it can get really stuck in your tissues and make you feel horrible. And so I started incorporating ozone with people, and, they were absolutely already improving. They were, responding to the therapies that we had. But when I added this, it was like, it just went, it just went straight up as far as improvement. And it's like, and getting through all of our treatments faster. So it's like shortening the treatment time. So maybe you're doing a little, you're investing a little bit extra in yourself in the short term, but you're healing so much faster.
And for most of us, if we could turn a little bit of extra investment into faster turnaround time for healing and getting ourselves to a spot where we're feeling better, it's totally worth it.
Yeah. And getting yourself back to where you want to be, where you're thriving, right? Like where you're doing your normal routine, you're feeling great. So, those are kind of our bigger areas. So if we're thinking of like pain, joint dysfunction, back pain, any of those things, again, acute or chronic. If we're thinking of, didn't think about infection. So if you have some sort of infection, of course, we've given examples of that. Like, so.
Is it used in anything to do with any type of malignancy, like a cancer type situation or anything like that? Are there any use cases there?
So there are a lot of studies actually around cancer. And unfortunately, they're not done in the U.S. because the U.S. has a very strict, in the things that they allow to be tested, you have to be approved to be able to do that with cancer. But in other countries, there are actually many, many clinical trials with ozone in different types of cancers. And most times it's used as what we would call like an adjunct or an additional therapy. It's not the only thing they're doing, but in the different studies, they've looked at breast cancer, they've looked at, really there's a large list of different types of cancers that have been studied, and it appears in, I would say most, just because I haven't seen all of the studies,
many of the
studies that I've seen are absolutely like there is a 100% benefit to including that therapy with the regimen. Now, here in the U.S., anytime we're doing any sort of, additional therapy, every doctor in the U.S. has to get the approval of the oncologist, unless you're working in integrative centers that actually they already have that set up. You're already going to an integrative oncologist. and it's already incorporated. So those centers do exist.
So it's a little bit different scenario with a situation like cancer in terms of how that would work or how that would be integrated.
I would say, I mean, you absolutely want to talk to your team. If this is something that you are experiencing or you struggled with or you've had in the past, you should absolutely 100%, get in touch with an integrative oncology team for sure, and then ask those questions. Absolutely. About that, including that therapy, or maybe going, hey, after I do my chemotherapy and radiation or my surgery, right? Can I do ozone? And generally, once you're cleared, you're free to do whatever you want to do.
Got it.
At that point.
You mentioned joint pain, and I know that that's something that we've done here before quite frequently, and it's something that we actually have some treatment packages that build these adjunct therapies and kind of pair them in a perfect way with other synergistic therapies like a PRP, platelet-rich plasma
there
therapy,
you go.
right? So PRP and ozone can go hand in hand in terms of treating joint issues. Let's talk a little bit about ozone in common joint pain like knee pain or arthritis in the knee or whatever that degenerative condition is in your knee where it's causing that sticky chronic ouch when you're walking or running or hiking.
Yeah, I love that combination. So when we're addressing joint pain, yes, we have several approaches like PRP, the platelet-rich plasma, your own blood, your platelets are activated, then you can take that and then we can inject it anywhere into your body. So say, for instance, your knee. I love comboing that with ozone, essentially. So you can do it through blood ozone, so the major autohemotherapy, or MAH for short, right? But really just following that PRP, following it with the ozone injection. You can do it directly, and it's fantastic. We're nourishing all of those cells. We're oxygenating, a hard to oxygenate area. I mean, so when you look at things like tendons, they're whitish, right? It's because the oxygenation is really poor. And so when we improve that, the potential for healing increases again, exponentially, right? So my own experience with like tweaking my knee from skiing, I had a colleague inject my knee, that particular one, without PRP. It's called Prolozone. So I did Prolozone, and it was probably 90% better. And then I finished it off with doing one MAH therapy and totally gone. I mean, just those two, that's all I needed. And I had been doing all of the exercises and the PT, and I was doing electrical stim around my knee, and I was doing the other vitamin IVs, which are great for everything, but it just didn't seem to be taking care of the tweaky thing in my knee, right? So absolutely. I mean, we don't always have to do this particular therapy as an IV, but sometimes when there are multiple areas in the body, like somebody maybe has a knee and they have a shoulder and their back, and it's like, well, instead of injecting every single area, let's just do some IVs.
Whole body.
Yeah.
Yeah, I've had a little bit of experience with it in the injectable format when I had my pec tear. That was part of our treatment regime.
Right.
That absolutely helped speed up the process of getting me back to a functional state. We were doing a bunch of other stuff too. So I wouldn't be able to pinpoint exactly and say this is 100% what the ozone did, but I will say in combination with all of the therapies, it definitely sped up my process. It got me back to a spot where I was able to start with my physicality and start with my training regime, ahead of what the PTs and whatnot had expected. So that was pretty cool.
That's fantastic. I know, it's fantastic. We did do some shockwave. Yeah, it's a whole other subject. Check out shockwave, like if you're experiencing certain...
If you have a muscle issue or joint pain, tear, thing like that, we have a lot of tools for you.
We have a lot of tools. Please come in and see us. Absolutely.
So we covered a few big ones then for ozone.
So just really infection, just to kind of say quickly, like if you have, times when I've used it, say if you're thinking about when should I come in? Like just because I have a cold, well, that might be a little bit overkill. You can. A flu, for sure. We're going to isolate you a little bit so you don't give the flu to everybody, but we can absolutely put you in a separate room, do it.
Maybe a chronic cold or a cold that's lingered.
Infection, yes. A chronic infection. That's where it's going to really shine. I mean, and your chronic mono, situations. Usually we want to do a series of those if we can't seem to get that mono under control and those viral levels keep spiking, and it's exhausting you. So then we want to do a series of that. It works very, very well. And then, like in the situation, I've had the opportunity to treat people who've had chronic gut infections like a diverticulitis, where it was not responding to antibiotics. And the next step was going in and looking at surgical interventions. And we were, again, sometimes you go, well, it went away, like it resolved it after a few treatments of the IV, ozone. Was it already going to do that anyway, even though things weren't responding? Maybe, maybe the body was healing. But I've had that happen now several times, and people responded really, really well. So, and then also things like shingles, so that's a big one, that if you've had chickenpox in the past, you're at risk of getting shingles, a very painful herpes outbreak on the skin. And so we've gotten people in right away, done like an IV ozone, and then it's resolved within a couple of days. So, which that's unusual. Usually we don't see that with like the antivirals. And I'm not saying don't do the antivirals. Do the antivirals in addition to, doing the oxygen therapy.
I love it. It gives us a lot of different ways we can think about treating some things that are hard to treat and some things that can be slower to respond to our traditional regimes, which we're going to do. But this ozone might be a way that we can speed the process up and really help with the healing of some of these specific conditions we talked about. So if you're with us today and you've been watching or listening and you're thinking that, man, that kind of gets some wheels turning, or you're wondering if it applies to you, or if IV ozone or injectable ozone therapy might be something that could help your situation, and you're not currently a patient, obviously give us a call. If you are currently a patient, bring this up next time you're in, and we'll absolutely discuss it and talk about how it could apply to your specific situation. And if it's something that can speed things up, we're probably going to recommend it.
Yeah. Any questions? We'd love to see you, come in, book some time with us. And really, we will definitely go above and beyond just even talking about just ozone. We're going to talk about many things and want to see many things in your body, that relate to your healing and your ability to heal. We have a lot of tools at our disposal for you. So
awesome. Well, until next time, remember, elevate and thrive.
Bye.